understanding at least understanding. I know the treatment is difficult, but at least understanding brings us one step closer to the treating the patient. So in ergonomy, when we do psychiatric treatment, psychiatric organ therapy for the patients, our job is try to loosen up the armor and to resolve the armor, and in doing that, our job is to make the patient to be able to express their feelings more in a direct way and not in a distorted way. And by that, we try to establish orgastic potency and relieve the patient from the suffering that he has. This, when we try to remove the armor, goes hand by hand by the patient's ability to develop capacity of love and empathy and become incapable of lying. We also, in ergonomy, fantasize about finding ways to prevent armoring. Why I say fantasize? Because it is so difficult and so huge that at this stage we can only fantasize about it. But fantasy is a good thing because it moves us toward that goal. Once a chess master was telling that how in playing chess he fantasizes, because he fantasizes what a good thing will be if the guy's rock will not be there and my queen will be here and that will be. So in that way then he moves toward that plan and something comes out of it. So we also in ergonomy fantasize about preventing the armoring, because I just to say that from our point of view, how pathologic, how destructive is the armoring and how much problems it can cause in the patient, which is unknown to medicine and psychiatry, by the way. Only few know, but that has its own reasons, and perhaps it's something else to talk for another occasion. In ergonomy, we try to prevent armoring, or fantasize to prevent armoring from the birth onward. Reich says when a child is born, he comes out of a warm womb, 37 degrees centigrade, into about 18 or 20 degrees. As it comes out, it is picked up by the legs and slapped on the bottom. This is the first greeting. First greeting is a slap. Next greeting is take it away from mother. It will sound incredible in 100 years. The baby has no body contact after having 9 months of body contact in a very high temperature, what we call it ergonomic body energy contact, and the field action between them. Of course, it's a little bit changed now. They are not removing the child right away now, and they're a little better. But this was the situation then. And then Jews introduced something 6,000 or 7,000 years ago, and that is circumcision. I do not know why they invented it, why they introduced it. It is still a riddle. And everybody says it does not hurt. That it is an excuse, of course. That is a murder. Circumcision is one of the worst treatment of children. They cannot talk, they just cry. That they what they do is shrink. They contract, get away into inside. Now, that is the greeting. This poor infant tries to stretch out, find something to hold on, find some warmth, goes to mother, puts the lips on the mother's nipple, and what happens? The nipple is cold. It does not erect. Milk does not come, or milk is bad, and that is quite average. So, how does it have to respond to that bioenergetically? It cannot come and tell you, oh, listen, I am suffering so much, so much. It just cries and finally gives up and says no. It does not say no by words, but that's the emotional situation. Now, why I read this? Because I wanted to introduce how the grounds for armoring start from the infancy. Reich in this way describes the beginning of armoring from infancy. Later, and during different periods of development of children, harsh toilet training, and during genital phase of 3, 4, or 5 years old, what Reich called first puberty, the genital sexual impulses become strong, and harsh treatment of the children during that time for their sexual impulses lays the ground for the armoring, or might even cause armoring. And then in the beginning of puberty, around the ages of 10, 11, 12, old, the hormonal changes causes changes in internal organs and genitals. The genitals start to become ready for genital contact, and child enters the stage of adolescence. When puberty starts, sexual impulses and urges become strong and urgent. This goes hand by hand with high emotional sensitivity. This age is very sensitive age. Young people on this age are very sensitive about their appearance, their body, and to prove themselves. Recognition of sensitivities of adolescents in these years and proper handling of them, acceptance, love, education, support, in financial security and social support, in providing nurturing environment, these things we in Orgonomy agree with all other social institutions that deal with this type of situations and individuals. However, there is one major difference in Orgonomy with other institutions that deal with the adolescents. We in Orgonomy stress on the aspect of adolescence that other institutions and disciplines avoid it. And we stress on the need of sexual happiness of youth, a subject that has not dealt with at the time of Reich by any social institutions, and even they have been hostile against it, and it's not dealt now, today. Maybe it's a little better now in the Western countries, but still it is not dealt properly. In contacts that I have with adolescents and their parents, in my practice, in daily interactions with them, I see a wide range of problems. Young people were brought to office and come there, they have different complaints. Attention deficit disorder is one of the major ones. Attention hyperactive disorder, then other fancy names, oppositional defiant disorder, as if it's a major diagnosis and they come for the medicine and all these things, you know. They come, they say that he was diagnosed as having oppositional defiant disorder. So they come, all these things, they look for a medicine. When they ask for tests for attentional disorder or behavior disorder, etc., they come for suicidal ideations, cutting behavior. In dealing with these young people, adolescents, I realized that they have been left alone in dark, with no explanation, no teaching, nothing about most important aspect of their development, their sexual development and maturation. This silence prevails in families, in the school system, in teaching institutions. There is no single institution that deals with this matter. It is like deja vu of my own adolescent years, and that was in Iran. In other words, some 40, 45 years ago, 50 years ago in Iran, the situation, I think, is same as it now, because there's nothing, no discussion. They are afraid to talk about sexuality. There is no teaching about normal sexuality, how normal sexuality should be, how they should handle their sexual impulses in the absence of possibility of sexual contact,